I'm Dr. Danny Bass, and I have one of my favorite patients with me here today, Trevor. Trevor just recently got his braces off, and he did the MEAW technique, and he's got such an interesting story to share. So Trevor, thank you so much for filming this video with us here today. So Trevor, tell me your story.
All right, so my name is Trevor. My story was originally I have a pretty severe open bite, as Dr. Bass would contest to. And for a long time, I lived with that. I had braces when I was a younger kid, but the bite just opened back up. And so for a while, I was just living with unable to close my bite, to eat things, to eat cold cut sandwiches, to eat pizzas, having to cut everything up. And one day, I was on the other side of the world in the Philippines.
Wow.
And after just hearing from an orthodontist in the US that I would have to get surgery to fix my bite. And I wasn't looking forward to that. I was almost at the point of accepting it though, because it would get to the point where I was starting to feel some jaw pain, where I just couldn't eat anything. It just felt weird going out to eat with people, especially if they're like, let's go get pizza. And you're like, oh, can we get something else? Because I just knew that eating in those settings was just weird. It was awkward. It was messy. You know, if you want to go on a date back then, before I was married, you know, you're like, okay, where do you gotta choose where you eat strategically so you don't look like a fool. So I was in the Philippines. I was taking my then girlfriend to her dentist appointment, and her dentist was also an orthodontist. They dual specialty there.
Okay.
And I was telling him about my situation, how I just got done with an appointment. They're saying I was gonna have to get surgery. And I just remember him going, no. Do not do that surgery. Okay. It's very barbaric. He said, find someone in the US that does this. And he spelled out and wrote on a piece of paper, MEAW.
Wow.
He said, find someone that does that.
Wow.
I came back to Virginia, I looked it up, found a couple orthodontists in the area, and they said, never heard of it, or I've heard of it, but I would never use it. And then looked a broader spectrum. My parents lived down here in Florida.
Okay.
So I found out that there were two specialists, your mentor,
yes,
Dr. Coro.
Dr. Coro, he's great too.
And you.
Hey, all right.
And I was like, well, what do you know? Well, it just so happens my profession is an airline pilot.
Okay.
So I can fly for free.
There you go.
So I was coming down visiting my parents. You remember my mom? She came up and visited you for the first time.
Yes.
And we sat here and got the full diagnostic, and from there the journey began.
Wow, man, that is a wild story.
Yeah.
And we are just so honored that you chose to fly down to see us for all of your visits, for the consult and for all the visits in between. We're so honored that you would have made that choice to travel all that way to see us. And so what was your treatment like as you were going through the journey here with us?
Well, I'll never forget that first visit, the consult visit. When you really started showing me the before and afters, when you were telling me you are a perfect case. But we did have a moment where we weren't sure this was going to happen, right?
Right.
We had that moment. I had shortened roots on my upper front teeth, and we were really concerned about severe root resorption if we reactivated the teeth.
Right.
And I just remember in those moments, though, I almost teared up seeing the before and afters, and seeing it was right here. It was so close.
Wow.
And yet we had this moment where we were like, I don't know.
Yeah.
But I will say the one thing that triggered it was when I was sitting in here and I heard the music. I heard the Christian music, and I realized that we shared the same core values, the same beliefs, the same trust in Jesus. And I knew in that moment that this was more than just me suddenly having this, oh, what a coincidence moment that I found out about this procedure in the Philippines and then come here and you just happen to live 30 minutes away from my parents, right? I realized in that moment that we have this obstacle, but I feel like we need to push through it.
Absolutely.
So once we got over that fear and we just jumped right in, I really was just like excited.
That's great.
I'd been to orthodontics before, and so of course you give the whole spiel, and we're gonna put the braces on, and you're gonna feel sore. And I was like, yeah, I know. So I did feel sore, but I had it. I expected it. We got through that, no severe pain there. But I was really looking forward to once we got to the MEAW part.
Yes.
You know?
Yes.
I was so looking forward to that.
Yes. So we had that initial obstacle of the shortened roots from previous treatment. It was, you know, it was kind of a risk. We're like, well, are we going to be okay with these roots? And we just watched them really closely. We took an X-ray about every other month or so.
Was that the most X-rays you've ever taken for a patient?
I think so. But we were watching it really closely, making sure that everything was healthy as we made progress. And thank God that the roots maintained good stability going through the treatment. And so we got you leveled in the line, teeth all straightened out. And then we finally got to the part where we started the MEAW wires and correction of the bite. And what was that like once we got started?
Well, once it was like the day is finally here.
Yeah.
And I remember when you put it on, and I was like, this is a weird sensation. Because all of a sudden you go from tightness to torque. You feel the torque of the activation in that vertical axis.
Yes.
Right? But it wasn't painful. It was just a different sensation, like, oh, we're moving in this direction now.
Right.
It was a good process, but it was amazing. I actually did take photos from almost every milestone.
Okay.
You know?
Yeah.
And so I have this little photo album on my phone of the before and afters, and I have it before we put the MEAW wire on, when we put the MEAW wire on, and I think just before we took them off. And just seeing the bite close was absolutely incredible.
Isn't that such a rewarding thing to see and experience? It's amazing.
Well, especially when you were just told that the only way to fix this was surgery.
Wow.
And even that would carry huge risks for losing my front teeth.
Right, of course. There's still no guarantees with the surgery, but you know you're going to have a huge recovery and you know all the added risk factors involved with the surgery, like loss of sensation in the teeth, and the jaws and the face.
And add on top of that, you might lose your teeth still.
Exactly, exactly. So it's like I understand why you wouldn't want that surgery. So glad that you found us, that everything worked out so well. And once we got started with the MEAW wires, was it like a long journey for you before you felt like some changes, or was it was pretty quick, right?
Honestly, I'm gonna be straight honest. I was thinking this the whole time. I felt like we took those off way too fast, way too soon. I was like, I've been waiting this whole time. It felt like it was like 2 visits. And it's like, all right, we're popping the top one off. I'm like, that's it?
Yeah,
like, we're done with it? Like
the bite closed real fast once we got you squared away. So
I was like, I think we need to put that back on. I've been waiting for this whole time. Like
yeah, it's true. It did happen pretty quick, and it usually does when I have patients like you that do a great job with the rubber bands. It makes a huge difference. So great job, way to go.
Thank you.
It makes it's awesome when we have great patients like Trevor. But yeah, it happened really quick. The bite closed together for you, and I think we finished up was like right around 2 years.
Right around the 2-year mark. We did. You did an excellent job meeting that, and we didn't cut any corners. I told him, I said, this is my goal, but I've put all this effort in, and I want to do it right.
Of course.
And I think I even told you that at the beginning. I was like, I'll come my half, you come your half. Let's just give it our all.
Absolutely.
And let's even test the boundaries. I was like, I'm at that point where I have nothing to lose. It's surgery or bust, right? So I was like, let's push through those boundaries a little bit. Let's put our faith on the line here, and let's go for it. And so I really appreciate you being willing to go to that point, because like you said, I think I was pretty much on that line where you're like, I'm gonna have to turn this kid away because this is really quite risky.
It was close. It was close. I was really quite concerned when I looked at the amount of root resorption that had taken place in years past. But given the fact that he was, willing and wanting to do this and understood the challenges that we were up against, I was happy to help you out. And how do you feel now? You've been out of braces now for a couple of months.
Yes.
And what's life like after finishing treatment?
I can eat pizzas.
Yes.
I can eat a single chip and bite it off with my front teeth. I can do so much. I can eat a cold cut sandwich.
Yes.
And not have the middle part just spill out.
Wow.
I can pretty much bite all the way through it.
Wow.
And enjoy it. My life has changed so much for the better. People often are like the smile, and the smile is a big, but even before, I wasn't so concerned with the smile, but as much as the function. The function's really what I was so concerned about. So I think I even told you when we started, I was like, even if it looks like the roots resort, if we can get it as close to functional as possible, because we can line it up. And I was like, if it lines up and there's a little bit of gap, like I don't care. But we were shooting for that function, and it's just changed everything.
Wow.
Everything's just been changed.
Wow, Trevor. I'm so glad to hear that. And do you have any more soreness in your joints at all?
No, so yeah, when beforehand I had a little bit of soreness from just essentially, I think I was only contacting about 4 teeth on my bite.
Right.
And afterwards now it's a full contact spread around my mouth. I have no real pain or soreness when I'm waking up anymore.
Man, that's great.
I believe, I mean, for a while they were worried about the level of grind and wear that was happening on those back teeth, and I believe we've pretty much slowed that down to where it should be now.
Yeah, absolutely. It's so hard when only a couple of contact points are coming together on the back teeth. That puts a lot of awkward stress and pressure on the teeth. It can create abnormal wear patterns along the teeth, discomfort in the joints and the facial musculature responsible for chewing. So having that even support across all of the posterior teeth is such a game changer. And the MEAW technique is so special because we're not just bringing the front teeth together, we're changing the inclination of the back teeth. So previously they were all leaning forward, he only had a couple of contacts in the back. We intruded and distalized, brought those lower molars back and upright so that instead of having these kind of lean forward awkward contacts only in the back and open in the front, now we took those teeth that were leaning forward like this and we uprighted them so that they're nice and flat coming across for an even contact on the back teeth. And the roots of the front teeth were able to maintain a great stability because the majority of our movement was not focused just on trying to bring the front teeth together, which is not that stable. That would have probably created an increased resorption of his anterior roots. But because we were focused mostly on changing the occlusal plane, the molars were the main part of the movement, allowing for further rotation of the mandible, closure of the anterior open bite, and a stability of the roots on the upper anterior teeth. So happy for you, Trevor.
I love how you said that though, because one of the orthodontists I went to, when I told him about this method, he goes, "Oh, that's a bad idea because it's going to put too much pressure on the front teeth." And so if anyone goes to a consult saying, "Hey, I've heard of this method and I hear that it can, you know, fix my bite without going through surgery," and that orthodontist goes, "Well, you know, it's going to put too much pressure on the front teeth and you could end up having more resorption and this, that." Like he said, it's not the focus isn't the front, it's on the back. It's using that rotational torque on the back.
That's right.
And yeah, I mean, that's incredible.
Yeah, and I actually really loved how you said it was a vertical change because that's what we're doing with those molars. They have a premature contact in the back with the angulation leaning forward. And so we really are changing the vertical dimension of the molars, allowing for a better closure of the mandible when chewing. And so that's so cool that you mentioned that because you didn't study orthodontics.
No.
You didn't know that that's what I was doing, but that's really the key to the MEAW technique is really just changing the occlusal plane by changing the vertical dimension of how the back teeth are fitting together, giving them better support, allowing for a rotation of the mandible and closure of open bites. And so, Trevor, you're an amazing patient. Your case worked out so well, and a part of that was because you're such a great patient, and you did a wonderful job with the rubber bands. I mean, you flew down from Virginia for every appointment. My goodness, that's amazing. Did you ever have a bracket come off?
I did not. Miraculously, I never had a bracket come off.
Amazing.
Miraculously, I pretty much made it on every flight on standby, coming down. It was a journey.
Yeah.
It was worth it, though, and you are an excellent orthodontist, Dr. Bass. I would recommend people fly from California to come and see you.
Man, Trevor.
Thank
you so much.
You're very welcome.
Trevor, God bless you, my friend. It's been such an honor to see you through this journey.
Yes.
We love you. God bless you, and all the best to you, my friend.
Absolutely.
Give me a hug.
Love you, brother.
Love you too, man.
Wrap.
It's a wrap. Yeah, that's right. That's right. Oh, yeah.
The Spider-Man dad.